Okay, internal and external rotation of the knees. We're going to use a slider for this. Now, if you've not got a slider, I've also used paper plates, a book that's quite silky, or even paper. Have a go with paper if you've not got a slider. Or you could just turn your heel up as well. So it's basically trying to stop the leading with our ankle and isolate this hip in here as well. To do this as well, I can put some blocks in between. I could perhaps even put another one in there as well, just so I'm a little bit wider in hip distance, okay? 90 degrees. Now you can lower your seat further, so you'd be in more hip flexion if you wanted to. I'm just showing you from this position, so I'm just opening up my hips a little bit, but it'd be probably good as well, trying it in different ranges, be helpful with your squats too. So you're going to try and keep the compression you're working into our adductors in here, and then we're going to externally rotate at our knee on that slider, and then you're going to control it coming all the way back in. Okay, so same again, you're going to rotate out with that slider, really focus on that tibialis tuberosity, and rotating in. So working out and really try to activate the lateral side, the hamstring, and then really trying to work into the medial side. Can make it a little bit harder and put a band around, so you're working against a resistance. Okay, different bands, different thicknesses, different strengths rather. So again, so as I'm coming out, I'm working against the resistance in here for that knee, working, can feel that hamstring, and then eccentrically controlling all the way back into neutral. It's the same again, taking it away and bringing it back in. If you're struggling for internal, you can use something to tie against a leg or somebody holding it, just so you can then work into that internal pathway. Make sure that your hip's not rotating, and like I say, you can try it at different levels. Start off with making sure you can initiate that movement first from the knee, and this will help massively to help stabilize those knees.